and welcome to this Raising the Bar discussion about how strategic planning can advance equity efforts. Thank you for joining us. I'm Ruth Shim, Associate Dean of Diverse and Inclusive Education at the University of California, Davis School of Medicine, and the Luke and Grace Kim Professor in Cultural Psychiatry and Professor of Clinical Psychiatry at UC Davis's Department of Psychiatry and Behavioral Sciences. Today, I'm joining you in my role as a Robert Wood Johnson Foundation trustee, a post I've held since January 2019. Robert Wood Johnson Foundation is the nation's largest philanthropy dedicated solely to health. RWJF supports efforts rooted in equity that provide every individual with a fair and just opportunity for health and well-being, no matter where they are, where they live, how much money they have. Raising the Bar, a project sponsored by RWJF, does just this by providing a framework for healthcare to embed equity throughout its work. This framework can help healthcare organizations move from public equity commitments to action to create real and needed change. This work is close to my heart, as much of my research focuses on health inequities, including those driven by systemic racism. As an Associate Dean for Diverse and Inclusive Education, I'm tasked with creating an environment of inclusion and respect, and to actively recruit and develop a physician workforce that reflects the rich diversity of this community. Raising the Bar brings this work to life, and strategic planning is a fundamental lever to making this happen. Today's conversation is going to discuss just how strategic planning can advance equity in organizations' roles as providers, as employees, as advocates, and as partners. But before I introduce today's panel, I'd like to welcome RWJF's Melody Tullier.
Thank you for the introduction, Ruth, and to everyone joining us today. I am Melody Tullier, a program officer with the Robert Wood Johnson Foundation. I am thrilled to share some background on Raising the Bar, which we have supported since its inception in 2020. RWJF works with others to identify, understand, confront, and remove the structural barriers to health and well-being, including structural racism and multiple forms of discrimination that have been layered into these systems. I am privileged to work with grantees every day who are dedicated to transforming health and healthcare systems to advance equity and achieve better health for all. At the Robert Wood Johnson Foundation, we hear from healthcare leaders, including leaders of hospitals, health departments, insurers, and community groups, to name a few, who are committed to improving equity and being a part of changing the system. Faced with the COVID-19 pandemic and worsening health inequities, many of these organizations voiced strong commitment to health equity. They want to make progress on that commitment, but both want and need a guide. That's why the foundation launched Raising the Bar, a project guided by a coalition of partners and led by the National Alliance to Impact the Social Determinants of Health, or NASDO. Raising the Bar provides an actionable framework to embed health equity through the entire healthcare sector. Critically important is the fact that Raising the Bar was developed by those who give, get, and pay for care. The framework, which you'll see in a link in the chat box, identifies 5 foundational principles that continuously center equity work. These principles center on committing to a mission of health and well-being, pursuing health equity, serving the community as a proactive partner, sharing and effectively using power, and earning and sustaining trust. It also reminds healthcare leaders of the 4 essential roles they play as provider, as employers, as partners, and as advocates. And there are 14 actions that offer specific ways to advance equity in your organizations. To advance equity, we must approach our work and our roles differently. And strategic planning is an important way for organizations to make the shift and set the tone across the organization for equity as a top priority. I'm looking forward to today's panel conversation about many aspects of strategic planning. Back to you, Ruth.
Thank you, Melody. And I'm honored now to introduce our esteemed panelists. First, we have Rick Gilfillan. From 2013 to 2019, Rick was the CEO of Trinity Health, a $19 billion Catholic health system that serves communities in 22 states. Prior to that, he was the first director of the Center for Medicare and Medicaid Innovation at the Centers for Medicare and Medicaid Services. Before his appointment at CMMI, Rick was the president and chief executive officer of Geisinger Health Plan. He also had senior positions at Coventry Healthcare and Independence Blue Cross. So Rick, as an opening question, as a leader at two large health systems, you've steered many organizational strategic planning processes. If an organization wants to integrate equity across all strategic planning, what's the first thing you would tell them?
Well, thanks very much, Ruth, and to RWJ for the opportunity to both participate in the Raising the Bar creation of that as a member of the committee, and for participating in this call today. And I think it's important as we think about what we're trying to address, the underlying issues we've talked about, structural racism, income inequality, social services, and healthcare spending, the ratio of those two. And they're way out of whack in the US compared to other countries. We're spending much too much on healthcare. Most of the resources go to providers who have a narrow role on delivering medical care, not health. So there's no effective agent for improving the health of the population. So really what we're asking of providers and of systems in particular is to really transform what they're doing, to become very different organizations in terms of what they're producing. And that kind of transformation will require direct CEO commitment, and that will require direct board support. So to me, I think the starting point here is to actually get the CEO, the executive team, the board together. And actually, I think it will take a retreat, like a 2 or 3 day retreat, like we often do, to actually focus on the issues, the underlying issues, the realities of what their place in the community is, and to hear from community participants how they're viewed, what they could do, and what the community needs. So I think that is a very different slant on a retreat for an executive team and a board. And then following that, I think they need to look hard at their strategic plan and ask themselves, are they really committed? Does their mission, their vision, their strategic objectives really include or cover their commitment in this space? And I think the answer will be not. And then they need to think about creating a new strategic plan. And I would suggest they would have within that an equity impact strategic pillar, which would include major initiatives addressing equity and the other issues we've talked about in community health, and ask for every strategic initiative an impact statement, asking each owner of their strategic initiatives to state how that initiative either affects or is affected by inequities or driving healthcare equity in their community. And I would also ask them to include equity as a weight in their decision-making around capital allocations. That kind of a strategic review of the strategic plan, a change to the strategic plan, I think is the beginning of getting health plans health systems to seriously address the reality that they have the resources, they have the power base oftentimes in communities, they can make a difference, but they can only do that if they commit to doing it, if they really review their plans and their operations approach that exists and change it, and do that with direct and meaningful input from community organizations and community leaders.
Thank you so much, Rick. And next, I'd like to introduce Rachel Gonzales-Hanson. Rachel currently serves as the interim president and CEO of the National Association of Community Health Centers. Prior to joining NACHC, she served as the CEO of Community Health Development Incorporated, a not-for-profit community health center that was founded to increase access to primary care services. Rachel's involvement with CHDI began while serving as one of its founding board members. In addition to overseeing CHDI's operations and significant growth, Rachel focused on improving access to affordable quality healthcare for people from all social classes, including those from rural areas, agricultural workers, and veterans. So Rachel, my initial question to you is that so often community health centers, hospitals, health systems, and others establish and publicly articulate core values that guide their work. So how might you encourage strategic planning teams to include equity in this conversation while making sure they walk the walk and not just talk the talk?
Thank you, Ruth, for the kind introduction. I also want to say thank you to RWJ for all the work that it's done over the years. This work is probably, I'm going to say, going to be the most important that we do going forward into the coming years. Times are changing and we need to change with them, and this really sets a wonderful tone. So strategic planning is very important. And I would say that a lot of times we don't take the time to look at our core values. Everything that Rick said is so important, it's so key, but we really do need to sit down and look at the core values of each organization, right? They need to look at that and truly identify and understand which ones they can affect. And by the same token, they need to be thinking out of the box, not just within their own four walls. It's for the good of the community, the well-being of the entire community, and how are we going to get there to make that happen? And then we need to hold ourselves accountable to those core values, including in the strategic planning, right? So making sure that we have systems in place to be able to monitor our progress, to be able to pivot when we need to, if something does not apply anymore, has a different shift, or it has a different focus because of a shift that has happened in the system. And I think all of those things are very important. You have, the JEDI initiatives that must be embedded in everything that we do going forward. And I think it's important for us to all know that we don't have all the answers right away. There isn't a manual for us to be able to follow that says, here's step one, here's step two, but we all can share those ideas and share best practices and look to others to look at our documents and our policies and our procedures that are in place from a perspective that is more open, right, than perhaps we do, because sometimes we do get tunnel vision, right? So we need to make sure that we are holding ourselves accountable. And I think in a lot of cases, like in health centers, our governing board of directors who represent our patients and the communities that are being served, they must truly understand that their role in that. And we as CEOs need to make sure that they have the skill sets, right, that they're afforded the skill sets to be able to hold us accountable, because the board is the one that drives what we do and how we do it and ensures our mission is followed.
Thank you, Rachel. Next, I'd like to introduce Nadine Gracia. She is the president and CEO of Trust for America's Health, a nonprofit, nonpartisan public health policy research and advocacy organization in Washington, D.C. Prior to joining TFAH, Nadine served as the Obama administration as Deputy Assistant Secretary for Minority Health and Director of the Office of Minority Health at the U.S. Department of Health and Human Services. She also served as Chief Medical Officer in the HHS Office of the Assistant Secretary for Health and was a White House Fellow at HHS working in the Office of the First Lady on the development of the Let's Move Childhood Obesity Initiative. So Nadine, we've heard that one way to make equity a core strategy is to address the social determinants of health, identifying the inequities and disparities, learning about specific needs and assets of those affected, and then closing gaps with concrete actions. From your vantage point, how can or should the strategic planning team start identifying these gaps?
Well, thank you, Ruth, and it's a pleasure to be with all of you, and I echo my co-panelists' appreciation of being a part of this work and to RWJF for having TIFA be a part of raising the bar. Absolutely, when we talk about addressing health equity and think about this within the context of strategic planning, it's really important to understand the role that the social determinants of health play with regards to their influence on health and health outcomes. And as important as access to and the quality of healthcare are to an individual and a community's health, we also know that the community conditions, the social and economic conditions that we frame as the social determinants of health have an even greater influence on health. And we all are influenced by the social determinants of health. But yet we see these inequities, whether it's in housing or food security, transportation, education, economic and employment opportunities, that serve as significant drivers for the health inequities that we see. And so as organizations are thinking about approaching and how systems are approaching strategic planning and really prioritizing health equity, having this understanding around the root causes that are rooted in many of these inequities of the structural drivers of health through these social determinants of health is really critical. And ways to approach that and understand that is certainly having the data from a quantitative perspective really help to inform that, to understand the communities that are being served, and in understanding from these multiple sectors, whether it's in housing, transportation, education, employment, and economic opportunities, where communities are and where we see the inequities in these various domains. And understanding that means the importance of partnerships, because we know that addressing these social determinants of health is not solely the work of healthcare and the health systems themselves, but working critically with other partners. For example, public health, which is where our organization focuses, of the importance of public health as a key partner that focuses on prevention and broader population health, and can serve as a convener and the ability to have access to data and understanding community health overall, and also partnering with community and having community voice at the table in the design and implementation of these strategic plans. So critically addressing multi-sectoral partnerships when you think about social determinants of health, and then being able to identify the gaps and understanding which communities are in greatest need.
Thank you, Nadine. And last but not least, we have Carlos Laniax. He is the chair and board of trustees of Jersey City Medical Center, an affiliate of W.J. Barnabas Health. He has served as the Jersey City Medical Center board on the Jersey City Medical Center board since 2011. From 2014 to 2017, he was chair of the Medical Center's Quality Assessment and Risk Management Committee. He is the first person of Latinx heritage to serve as the chair. He is also CEO of Big Brothers Big Sisters of Essex, Hudson, and Union counties. Carlos, can you share how in your role as board chair, you ensure that the institution's priorities are aligned with the commitment to equity, that there is accountability at highest levels?
Sure, and before I begin, thank you, Ruth, and thank you to my fellow panelists. It's a sincere honor knowing about your commitments to this work long-term, and to RWJ Foundation for your visionary leadership in creating the platform, the places and the spaces for these conversations. I think I'd like to insert to add on to what the other panelists said, but from a different perspective. Voices from the ground matter. Grassroots voices and stories are valid. That's what got me to the table as a board member of Jersey City Medical Center. As CEO of Big Brothers Big Sisters, we would hear about the challenges, the manifestations of these structural inequities, structural racism, the manifestations of broken systems that played out in our families' lives, children, our families, and we would interact with this wonderful institution on many items on the back end of the process. And as we got more visible in the community, the culture and the institution CEO then said, well, you need to be on our board, and we need to have more representation of community on our board. So ensuring that the voices are not only valid, but that have a seat at the table has been part of our culture for quite some time. And it's from our RWJ Barnabas family on down to our local hospital, ensuring that there is a mindset that the validity of our ground level voices matter. And what does that turn into? That turns to a number of different things. We screen differently because of this. We see that the stories that we're told are connected to some data that can be determined on some destiny. We can be on the front end of prevention and valuing that with resources, with the way we treat our clients, our customers. And Rachel said it really well. I think the power of being embedded in the community. It's not them, it's us. We're not pointing the finger, it's we. We hire from our community. A majority of our staff at Jersey City Medical Center are from Jersey City, a majority. We have a highly diverse board of directors. We have a highly diverse set of executives from RWJ on through the system. And this is an important point to Rick's point. There are different levers we all pull. I'm a volunteer board member, right? we have different levers that we can pull as board members, as managers of teams, as clinicians on down the line. And so having a mindset that every voice matters, that every story is valid, is part of the shift that we've tried to take on. And frankly, I've witnessed, and I'm an articulation of that now, being the chair of the board of trustees for an institution that's been around for over a century.
Thank you, Carlos. What a great panel of expertise, and I'm really excited for this discussion that we're about to have. And so I think that we can launch right in and think about how we might best start in this process. So each of you have been involved in strategic planning for large organizations. And so where would someone get started? How would you lay the groundwork for these conversations? Do you start by gathering baseline data? Do you educate the leadership on or the staff on equity issues? Is there some other starting place? I would love to hear from anyone who wants to comment on the best ways to get started. Don't all speak at once.
Well, let me try to begin while others are trying to get their thoughts together as well. You know, I think it's important that we truly take a moment to educate and inform everyone about what those equity conversations are really about, and have those difficult conversations before the strategic planning. Because once you get to the strategic planning, you really want to focus on that, right? But we need to all make sure that we're on the same page about what does that really mean, right? And so making sure that all the staff, as well as the governing board and leadership, truly understand what the equity means and what we want it to look like when we finish with our strategic plan, right? So I would think we want to start with the education first.
And just to add on to what Rachel shared, I think that it's important that, as was noted, is that leadership commitment, and Rick spoke to that in his opening comments, is really the framing that this is a leadership commitment, and that it's an organization-wide, a health systems-wide priority. And often in doing that education, it's also understanding the audience that you're going to be educating, because even within that health system, you're going to potentially have to do that education in different ways. For some, it may be the data. For others, it may be the patient stories and hearing about the experiences of patients in that health system. And for others, it's a combination of the two, and tying that very closely to the organization's mission, and tying it to the core values, as was noted, and why this is so critical to the way in which we deliver healthcare. When it's seen as a separate type of an activity, when it's seen as an add-on, then it feels like it's a burden. And if it's not closely linked to the organization's mission, values, and understanding that this is really part of how we address and provide quality healthcare to all equitably, and ensuring, as Rachel said, there's a clear understanding around definitions so that everyone has the same foundation of knowledge, that is key. But making sure that you understand the audience that you're actually educating, whether that's the board, the C-suite of leadership, whether that's staff throughout the health system, whether that's thinking about partners in the community and learning from partners, is being very tailored to the audience that you are engaging and collaborating with.
I think also I'd like to add that to creating the spaces and the intentionality, have these conversations on the spirit of education. As I was taking on this role, I was advised by a mentor of mine who helps influence a lot of healthcare boards around the nation. And someone came up to him, a board member, seasoned board member, prominent member of his community, and said, "Listen, I've heard about the social determinants of health. We nod, we move forward, and we treat it as we all know the same level of content. But I'm a real estate guy, and I actually don't really fully understand everything that's involved that drives this conversation forward. And frankly, we all have our filters in the way we view things, our life experience, our professional experience that helps lift up some of the ways we view things, and maybe could be augmented by hearing and learning more. And so what we're trying to do is at our board meetings, we're creating these deep dive sessions where we're going to take different issues that we may be talking about in regular form, in our regular agendas, and use an expert to dive deeply into the content of that issue. So social determinants of health would be one. And so it doesn't allow people just to take some things for granted, passively sign off and move on. And that should, frankly, this past summer, our leadership team also, led by our CEO, Representation Matters, we had all sorts of wonderful leaders at the table the entire time, from board members to leaders on the ground, effectuating the work in a retreat. And we were grappling with the main drivers of our operation for an entire day, creating the space and the forum to have those conversations, to go deep into them, to not take some information for granted. And it starts really at the board level too. My mentor encouraged that many board members are selected for expertise in one core area, but hospitals encompass so much more. And they touch upon the wide diversity of a community that needs their expertise to be heightened, the board members' expertise to be heightened. So we're trying to do that in terms of a tangible thing going forward in our board meetings.
Ruth, I would agree with the comments that Carlos just made about the board, and that Rachel and Nadine have made about the importance of values and obviously the importance of the social determinants and the partnerships that are necessary to even begin to address that. I think back to at Trinity when I was there, it's been probably 5 years ago when we went through this. We went through a whole unconscious bias training program, right, around diversity, and extended out to 20,000 managers, or some enormous number of people training. And looking back, I think that was part of the story, but there's such a bigger story here, and it is a matter of getting that education begun with people, because we are, in terms of health systems, we're talking about asking them to transform into producing something else, not something marginal, not something. We're talking about them behaving differently, engaging with community differently. And I love Carlos's notion of every voice counts. And I think, frankly, as a health system CEO, that was kind of something I might mouth those words, but I didn't live by them, and I don't think our organization did. And I think understanding the importance of that, and understanding these connected issues of racism, structural racism, and social determinants, and income inequality, and the fact that the health system is taking so many resources from the community and not using them as efficiently as they could. Those are big issues that need to be discussed, I think, and it's important for leadership to kind of confront them and say, yes, we are making a commitment to change the organization, and to change and to educate the rest of our team on the meaningfulness of these issues and the necessity of our response. So I think strategic planning can be an agent, to go out to urge all of you folks to go back to say to your leaders, we need to have a conversation at senior levels about these issues. And raising the bar provides a great framework for them to talk about it, right? To ultimately and see in each of the actions and principles, you can see today's operations of health systems, and there's opportunity for them to change those operations. And it's not a big add-on; it's a way of doing those things differently, with different thinking about them. So it seems to me that's a conversation that strategic planning is well positioned to initiate within their organizations.
Great. I appreciate everyone's comments on this, and want to segue into, I think, a really important point that you all have kind of raised about how we might embed equity into the work of the health system, into the strategic plan, because it plays a role in every aspect of our organization. So as providers, employers, partners, as advocates, how would we work to ensure that equity is incorporated in every aspect of the strategic planning process?
Well, again, I mean, let me take a first swipe at it. Thank you, Ruth. I would start defining the buckets in areas and then dive into each area. So if it's patient care, if it's workforce, if it's the communities in which we serve, if it's operational items, the spending power of our institutions is notable. And in those categories, there's so many ways to be specific, be accountable. So for example, in operations, we have RWJ Barnabas, led by our leadership, has taken on Ending Racism Together as a campaign. And within that, we take on vendors who want to do work with our system, and it must sign off on a pledge to end racism themselves or be an ally. I mean, that's within the contractual language incorporates that. And that is a new element to how we do business. The ripple effect of that is yet to be told. When it comes to patient care, we get very specific on the number, the data is clear in some of our communities. And so we get specific on how to measure it in advance. The number of breast cancer screenings for African-American women, we measure this and report this to our board. So you define, I guess, the categories that are relevant to your community. And then within each one, you drill down. Workforce, the majority of our staff are from our community. And what does that staff morale look like? What does that tenure look like? What does that ability to grow in your profession look like? And what are the measurables? And then sometimes in that level of specificity, you may have to confront some not great truths. And then how do you become a culture that addresses it, doesn't shy away from it, and grows from it? And that's part of, again, the initial comment that I was honing in on. This is a journey. This is part of a commitment to have a mindset that is a long-term conversation, that perhaps the end goal, we have a crystallized view of what that is, but it is such a long journey to get there. And so the commitment to get specific, accountable in each of the categories that are relevant in one's own community is absolutely important, especially when you talk about those measurables. Did we do enough proactive screenings within the African-American female population within our community? Did we do or did we not? What is the accountability on that? How do we strategically target certain areas to effectuate our big strategic goals?
I would just to say, and great examples that Carlos has given, just to draw on my previous experience in working in the Department of Health and Human Services, and specifically leading the Office of Minority Health. When we launched in the department our action plan to reduce racial and ethnic health disparities, one of the key priorities of the secretary was to lay out a secretarial priority in addition to all of the action steps, but to have as a leading secretarial priority was that across the department, every agency needed to prioritize equity and look at its operations, its resource decisions, its policies and programs to ensure that we were actually advancing and addressing health disparities. And so that approach of one, that it's systems wide and that you're looking at, as Carlos noted, the various levers that can exist within the healthcare system to be able to say, how can we look at who is being disproportionately impacted, who has not had a seat at the table, how are these policies, practices, potentially advantaging certain populations and disadvantaging others, and then being able to utilize data, for example, that's going to then inform how would we develop or change policies and programs to help support all communities. But I think an important aspect of this is to not start this in an insular fashion, just internally within the health system, is to recognize that communities should be in this from the very beginning. And so if you don't have those trusted partnerships and relationships, it's actually earning that trust and building that trust with trusted community leaders and organizations, and also working with other partners in other sectors. I mentioned in my opening comments, for example, working with public health. And I'm so excited to see so many health departments, public health departments that have tuned in for today's webinar. Because public health in and of itself is really focusing on that broader population health, community health perspective. And so they'll have a sense of what the community health metrics are looking like within communities and where we see those disparities and inequities, and also know of key partners to be engaging with that they can help to be a convener, they can help to leverage these opportunities in working with the health systems to be able to outline what are the priorities, because it's important to know that sometimes the priorities that a health system has may differ from what the community has. And so hearing directly from the community and community partners that will understand this will help to shape the direction of the strategic plan as well.
I'd like to add something to the great comments that Nadine and Carlos have said. And this is something that, I think that I learned when I was working at the health center. The majority of our staff were Hispanic, the majority of our patients were Hispanic, the majority of the community was Hispanic. Does that mean that we absolutely had equity from just because of that? Absolutely not. Absolutely not. And if we're talking about equity for all, we mean equity for all, right? And it's not just about race and ethnicity, it's about other kinds of minorities that are out there that need help, or other kinds of instances, right? So we need to make sure that we don't just assume because we're already in the majority in our community or in our staff, that's it, that's enough. And that's not all that we need to do. We need to look at every aspect of equity and what does that really mean in our community, if it is about the community as a whole.
Thank you so much. We have so many audience questions that I want to move on so that we can get to some of the many great discussion points that are coming in. So I'm going to ask our first question from the audience, which is, what are actionable ways that we can help hold our organization's leadership accountable?
I think we've touched on it a little bit, but those measurable objectives are really important, right? And it's again, Carlos, the journey piece, right, is exactly the truth. We do not have to say we've got to do it by 6 months or we've got to do it, but we need to do it, set some benchmarks, and then say we will grow progressively if we need to do it that way. Others can be done faster, and that's fine as well. But I think setting those benchmarks and then monitoring those benchmarks, and wouldn't it be a great idea to also share it with the entire community and let them know, hey, this is what we said we were going to do, and this is where we are now. And let's put it out there for transparency and feedback.
I would add that, we talked about earlier on the importance of having leadership or the board getting together, ensuring that there's leadership buy-in and commitment, understanding that can't be a one-time conversation. That has to be an ongoing conversation, and that leadership has to continue to express that commitment every day throughout its work in what it's doing to really advance this mission and this goal. And I agree with Rachel, setting some clear benchmarks, metrics, goals, both in the short term and long term, and then having a clear governance structure about how the strategic plan is going to be implemented, how leadership is going to monitor this, and how leadership in all departments and entities within the organization are going to be held accountable. That can be whether it's through the metrics that you use, for example, in looking at specific health outcomes, but it's also looking at other metrics. It's also saying, are we seeing changes, for example, within our contracting? Are we seeing changes with regards to our workforce? Also, with regards to looking at our performance reviews, do we incorporate that, for example, into the performance reviews or compensation to demonstrate that we are taking this as a priority? And when we set forward and say equity is a strategic priority for the organization and create that governance, it's important that you provide the resources such that if there's leadership, whether it's in the form of a chief health equity officer or an equity team or equity council, that it has resources and that it's not siloed. That means budget and staff and authority and a seat at the table to be engaged in those critical conversations and reporting to the leadership of the health system to demonstrate that this is truly not simply an initiative that's on the side, but that this is truly central to the organization's core priority and mission.
It's also with that idea of the mindset of a journey and being open to the data that surfaces, the voices, the stories that surface from the ground up with sincere partnerships. So in New Jersey, same time last year, we know that people labeled as food insecure has increased by 50% as a post-pandemic reality. With inflation rates going off the charts, I see that on the ground at Big Brothers Big Sisters, the cost of living, especially in our part of the country, is disproportionately impacting our families and our communities. So how do we adjust on this? Of course, if we have the framework and maybe the data pre-pandemic was achieving certain goals, to perhaps adjust. And I'm proud that we have a campus kitchen where we're trying to repurpose unused products in our cafeteria that would then be deployed into the community. And we've raised over 100 pounds of repurposed food for people labeled as food insecure. And so it's creating a culture that's mobile and agile to address the shifts as they become present to us from the ground up as well.
Ruth, I think there's ample opportunity. There should be ample opportunity to hold leadership accountable for making significant change. And I think having them lay out a plan that's specific, as folks have said, that demonstrates that they are taking serious action on multiple dimensions. Again, many of the dimensions laid out in the Raising the Bar framework. Reporting on that, not once a year, but on a monthly basis, progress being made. And there's some opportunity for metrics both on the administrative side and on the clinical side, but it's early on the clinical side and there's data issues and all that's true. What we don't want to do is kind of give everybody a pass until the data is right. We need to see a commitment, resources, and actual feedback from leadership that demonstrates that things are different. This degree of change will require major changes in investments, and I mentioned capital allocation before. Is equity a criteria when those people sit around the table and vote on whether or not they're going to invest in this hospital or that hospital, where the dollars are going to flow, right? So leadership demonstrating that they actually have inserted this consideration. And I called it an equity impact statement, but you could do that on both the strategic initiatives and do it for operational departments. Hey, Mr. Resource, Mr. Supply Chain guy, what is your equity impact plan? And give me a report on a monthly basis as to how it's proceeding, right? Those kinds of very specific expectations at both the strategic level and in operational departments is what it will take to actually create meaningful change that we're after.
Thank you. I have another question that I think Carlos would be best to answer, and it relates to balancing. So how do you balance building board capacity with the fact that many board members are volunteers and likely have a lot of other commitments? So how would you institutionalize that capacity since many boards transition more quickly than staff?
Well, I think it presents itself, I guess, similar to my journey. When you see people actively in various conversations and leadership positions wearing different titles surface themselves regularly. We have a wide variety of policy groups, active associations, people that are leaders in their core areas. And I think those people care about community beyond self. And so pulling into the wide range of leadership is a mindset that our institution has had. We have people who are born and raised from our community, and they say that proudly. So there's a deep well to draw upon. And then as we think going forward, how do we make this a rewarding volunteer experience, right? We're not paid to do this work as volunteer nonprofit board members. What keeps us at the table, what keeps our volunteer board members wanting to stay and fight for staying for longer if they could, and if the title is removed, they still stay involved, is because they see the impact. They live and breathe it. And so this is why the word embedded means so much to me, in that we are the community. And so when I'm in the hospital with my mother or a family member or one of my young people in my program, it's a highly personal experience and a moment of pride too. And so that I could be part of this conversation is deeply rewarding. So I don't see it as much of a challenge as just trying to, ensure that we had the mindset to be open to the leaders that are already present in the community doing the work. And they may have, if we change the filters to say you have to have this dollar amount associated with the title, or you have to be of this stature in this kind of way, but really level set and say, we want people who love on this community and want to be part of this conversation. Then we can enter new people. And that is an abundant mindset. There is so much within our community if we change the lens in which we view what board membership looks like.
So thank you for that. And I have to tell you, this discussion's been so engaging that we're pretty much out of time. So I would love to hear from each of our panelists, perhaps the one piece of advice that they would like to share with the attendees when it comes to strategic planning and equity efforts. And let's start with Rachel.
Okay, you know, I would think that for strategic planning, a lot of times we want to use an in-house person, right? Somebody internally. I think we need to bring people from the outside to help us think out of the box. So I think for sure that would be one thing. And as far as equity, you know, I have to go back to education. We really all need to be educated on what that truly means. And I don't, you know, as much training as I've had lately, especially with NAC and all the work that we're trying to do there, I still don't think I have the whole picture of what that truly means. So I think the education has to be ongoing to make sure that we can really get where we need to be.
Thank you, Rachel. And Rick, what is your one piece of advice?
Well, I think, you know, healthcare equity and social determinants of health, they're kind of a little bit of like, you know, the next hot thing, and we have to be careful in the healthcare world. These things come and go, and we have to make sure that it doesn't, this isn't one of those times. And it's also a time, and when that happens, everybody has their view of what it is and, you know, how to talk about it. And I got my framework, you got your framework. I would say to folks, this is a great framework. Raising the bar works. It's directly insertable into the strategic plan that you have today or the operational plan you have today. Use it and then ask your leadership, hey, I got these strategic objectives. I don't see anything in here about equity. What do you think? We got to, you know, are you ready to actually make a commitment to address these issues and transform the way we operate? And if you are, I got a framework that will help us do that. And I would urge them to make use of the the great work that that RWJ and the team has done to create these.
It really is a roadmap, which is just great. Carlos, your one piece of advice?
Honestly, embrace your voice. And I think that's, I guess, how my journey is different than perhaps others in other boards and similar positions around the country. Just be confident in the testimony and the lived experience that brings you to the table, and know that that's helpful and important. And it's also a marathon. So embracing your own testimony is important, but knowing that we can't get everything the way we see it immediately. And I've been working at Big Brothers Big Sisters for 14 and a half years. I know it to be true that the journey is long for real work on the ground to be played out. But ultimately to embrace one's own testimony and be confident in that. And if it's the title of board member or executive or community grassroots leader, those titles vary. Who you are won't, and be true to that.
Thank you. And Nadine, you get the last word.
Thank you, Ruth. Well, I echo Rick's comment that the Raising the Bar framework is an excellent roadmap, and with it comes a roadmap that has bright spots so that you can actually see other health systems and the work that they have done and learning from each other and having that type of a peer learning network. What I would say is what we started with. It takes leadership, sincere leadership, commitment, and that the job of equity is not one person's job alone, that it truly has to be across the health system, and it has to be tied to resources and the ability to monitor, have accountability, and partner with communities. When you partner with other sectors and community, you can go farther. You can make a greater difference, and you can have a greater impact for the health and well-being of your community.
Thanks so much to our speakers for an important discussion, to RWJF for supporting the Raising the Bar project and today's conversation, and to our audience for their participation. I hope you'll spend some time with the Raising the Bar resources, which highlight organizations already working to raise the bar, provide insights to guide action, and call for all healthcare stakeholders, providers, practitioners, payers, and others in this effort. Visit rtbhealthcare.org to learn more and register for our next webinar. And thanks again for joining us, and enjoy the rest of your day.